the window because I've got a lot of traffic outside. All right. So like I said in the email, working on a story about us reaching that 50% milestone.
Yeah.
Now, we're obviously not going to be rushing to reopen. Restrictions aren't lifting. So, I mean, what does this 50% marker kind of really signify for us?
It's more psychological than statistical, but it shows us that the proportion of susceptible people is now the minority. So what does that mean? This disease goes away when the number of susceptible people gets so low that the disease cannot find purchase in society. The reason that waves keep happening is that there's still a large number of susceptible people, and they're susceptible because they're not immune. Okay? So there are two ways of reducing the number of susceptible people. Well, three ways really. One is that they get the disease and recover and get immunity. Two is that they get vaccinated. And three is that we prevent them from getting exposed in the first place. That's why we have these economic restrictions to achieve that latter goal, to prevent people from interacting and therefore not exposing each other. And it's also why we have the vaccination campaign to build in population immunity. So now that vaccination is above a certain mark, it means that one by one, the efforts to minimize exposure, that last route, can be lifted, and vaccination takes on the heavy lifting of reducing susceptibility. So, and eventually that number of susceptible people will dwindle so low that we have, I wouldn't call it herd immunity, but something resembling herd immunity, because we'll probably dip in and out of herd immunity at some point as the years go on. But the point is, we want to get that number so low that the disease just can't find a home anymore.
You mentioned that it's probably more of a psychological hump that we're passing now. I know you're not a psych expert, but I mean, in terms of this like sense of relief, or this feeling that the end is near.
Yeah.
The end of the pandemic. I mean.
Yeah.
Like how first of all, how optimistic are you feeling at this point?
I'm very optimistic, and I've spoken to so many journalists this past couple of days who are surprised that I am optimistic. But I think a lot of scientists watching the numbers are optimistic as well. Globally, cases have come down, so it looks like the peak of the wave, the most recent wave, whether it's second, third, or fourth, depending upon where you live, the peak is now behind us. There's some places where the peak is yet to reach, so parts of India, for example, but globally, on average, the peak is behind us. Locally, in Canada, the peak is behind us. In Ontario, it looks like this wave will be mostly done by the end of June, assuming all things go according to plan. Vaccination is up. The number of vaccines arriving is very, very high. The proportion of Canadians willing to receive at least one dose is like 90%, depending upon which survey you look at. So the combination of supply and demand fills me with a lot of joy. It means that people want to get out of this and they want to do their part to get out of it. And we look at places like the UK and Israel and parts of the USA where vaccination clearly is doing its job successfully. So in those countries, in UK and Israel, there hasn't been a COVID death in a few days, as far as I know, and that's astounding. It means it works, right? So we're on that path to be those countries. Now, the caveat, of course, is we can't be those countries tomorrow or next week, but possibly in a couple of months. Right? So there's a lot of optimism here. And I just spoke to another reporter about, does the messaging need to change? I think, yeah, the messaging probably does need to change a bit. We've been all stick and no carrot throughout this entire ordeal. It's like, hey, you better not socialize, or we're going to give you a ticket, or you might die. You might kill somebody because of your bad behavior. Yeah, all that is true. But it's also true that you might save someone's life if you don't do these things. So the carrot has been lost, and now it's time for more carrot, right? So continue to get vaccinated, and we might accelerate this timeline. In addition, guess what? Guess who did this? We did this. We all did this together. I mean, David Fissman famously tweeted at the end of that first wave, as he showed the curve coming down, we did this together. And that was inspiring. And we've lost that message somewhere down the road, right? So right now, we're doing this together again from a combination of enduring these restrictions and voluntarily lining up to get vaccinated. Right? So this is
Mhm.
scientists didn't do this, politicians didn't do this, people did this. Um,
Mhm.
so what is the message from that 50% psychological uh, uh, milestone? It's, hey, we as a society have passed an important point in this marathon. We're at the sprint phase almost, right? We can see the finish
Mhm.
line, and even though we're all tired, we're holding hands together. We're going to sprint to the end together. I sound all
Mhm.
kumbaya right now, but it's there's something there about this. And the federal
Mhm.
government's roadmap lists 75% as their magic thresholds, and I don't know where they get those numbers from, but let's say they're accurate. Then we're 2/3 of the way there. So we all think that herd immunity is going to kick in somewhere between 70 and 90% probably. And again, herd immunity is a complicated thing, and let's not get too deep into that. So
Mhm.
the fact that we're not starting from zero anymore, that's extraordinary. We're at 3%
Mhm.
last time I looked, last time I checked the global rankings, which wasn't that long ago. And now we're at half? It's crazy. So
Right.
this can change so quickly, both in a positive way and a negative way, and looks like it's changing in a positive way quickly. So we should take the win and
Mhm.
celebrate the win.
Mhm. Um, you brought up some really good points there, and I didn't make notes. No, I'm recording you, but I
Okay.
wanted to come back to something, and now I forgot. But that feeling about, we're all in this together, that was so prevalent at the beginning of the pandemic, and then it kind of just like waned for a lot of people, and people just got tired and whatever. The Because we're reaching that point where more of us are going to be vaccinated than not. Is that the reason you think that we're maybe rallying together now, because we do see that endpoint?
Hmm. Maybe. That's a tough one. I think
Mm-hmm.
I think the creators of chaos, the disinformation sowers, are still there, but they're not as loud as they used to be. I don't hear them as much. And so the
Mm-hmm.
doomsayers are quieter as well. And so those people, I think the majority of Canadians who are quiet throughout all of this, who just persevered, who understood what they needed to do, and ignored a lot of the shouting, I think they're the ones who've come to the forefront now. They're coming out of their houses and realizing, you know what, we've done our job, and it's showing now. Like I don't get nearly the same amount of COVID denial emails as I used to because people understand, hey, it's real, and vaccination works. You know,
Mm-hmm.
so uh, is that sense of teamwork back? I think it kind of is, and a big part of that too is the
Uh-huh.
fact that the weather's nice.
Right.
And I don't think you can downplay what you see on the global stage, whether it's the USA,
Mm-hmm.
Israel, or UK. Right? We see other parts of the world showing that it's possible. Then, of course, our spirits will be buoyed, and we see how they did it. They did it through compliance and cooperation. Right?
Mm-hmm.
At the same time, though, we see India and Brazil, and we see what could
Right.
be if we are not as diligent. So it's
Mm-hmm.
not all good news, but there is some good news here.
Right. So, epidemiologically, what are we already seeing through our vaccine rollout, and like, what are we going to continue to see in the coming weeks, as more of us get vaccinated?
It's hard to disentangle the effects of vaccination versus the effects of other policies, what has driven this downward
Sure.
trend.
Right.
Like
Mm-hmm.
some of the modeling I saw back when we were at 3% of vaccination use, projected that this wave wouldn't be over until the end of August, but clearly it'll
Mm-hmm.
be over faster. So, I mean, the extent to which vaccination has worked, it's definitely going to serve to keep the cases down. Like the economic restrictions drove the cases down, vaccination will keep them down. In addition, the way that vaccination was used, focusing on high priority areas, was important. Lowering the age at which some people could get it in order to get hot zone areas under control, that was pivotal here. Um, but
Mm-hmm.
mostly, I think it was actually the lockdown and other restrictions that caused these numbers to come down. But the takeaway, of course, is if we want to keep the numbers down, you get vaccinated. It comes back to the susceptibility argument: is if
Mm-hmm.
it can't get into the population, then it can't get into those who are not yet immune. So we want to keep the number of susceptible people as low as possible.
Mm-hmm. So, in your estimation, I guess, where do we need to be? Like, what do the numbers need to look like for us to start lifting restrictions
Yeah.
here?
Right. So that's a complicated question. So the first thing is that we cannot do it according to an arbitrary calendar date. We can't say, hey, July 1st,
Right.
Having said that, I think it's a good strategy to aim for July 1st. It's a symbolic Canada Day, as a
Mm-hmm.
point at which we can mark when the ramp to normal is officially joined. But put that aside. You have to look firstly at the epidemiological indicators, then the health systems indicators, then the population indicators. So what are the epidemiological indicators? I think we all know reproduction number has to be below 1, the and stay that way for several days. The test positivity rate has to be low. I don't want to give any hard numbers, but I'll give you a number like 3% is not an unreasonable thing to aim for and keep it under that threshold. That's the threshold that New York State was using. Keep it there for a number of days with the caveat that testing must be maintained at a high degree. The incidence rate has to be low. How low? I don't know. It would be nice if it's like 100 cases per day, and less than that. So a tenth of what we have now, that would be all right. Again, that's just a number I pulled out of an orifice. It's not anything based on modeling. Then there are the health systems indicators, which are the harder ones. And that means how effective is our health system at absorbing insult? Right now, even though cases are coming down, the hospitals are still being used far too much. So ICU use is going to be a lagging indicator. David Fissman was on a radio show recently, and he was sharing that the film industry had contacted him about can they film in Toronto in the summer? And their biggest concern was if their stuntmen get injured, will there be space in the hospital for them? That's what this is about. Right? So even though the cases will come down, if the beds are still occupied in the hospitals, well, then we can't do a lot of things. We can't take a lot of risks.
Right.
So that's an important consideration. And the last are the population indicators. So those are how much vaccination do we have? And how eager are we to get more vaccination? And how likely is it that that eagerness will be fulfilled? Right? So I don't know what the magical numbers there will be. So all these things have to be combined into a model to show which levers can be pressed to prevent that downward curve from bending upward again. But in general, those are the categories we care about.
Right. A lot of us here for a very long time were looking at the U.S. and their vaccine rollout and being quite jealous, vaccine jealousy. But now it seems like we're outpacing the U.S. in terms of how many people per population we're vaccinating per day. I know they're running into some problems with hesitancy, and you quoted a study or a survey suggesting that maybe 90% of Canadians are open to having a vaccine. So do you think that we will not have the same problems that they're currently facing now?
I think we're going to face vaccine hesitancy at some point. I don't think it'll be quite as bad for a lot of cultural reasons. They have a lot more distrust in government and in the status quo. Their education levels, they're heterogeneous, but they tend to be a little bit lower in terms of science literacy. But you can't discount the effects of culture here. Having said that, we definitely have a vaccine hesitancy problem in Canada. It's not nearly as bad. We will face it probably sometime this summer, is my prediction. Right now, demand outstrips supply, but at some point, that's going to shift over. And then we have to explore some incentivization options. Like, I don't think it'll get quite as bad as the US, where they're offering cash rewards for getting vaccinated. I have strong ethical hesitancies about that. Like, we can go into that if you like, but you don't, if someone is vaccine hesitant, giving them money to overcome their hesitancy buys their cooperation for a day. It doesn't win their hearts and minds. It doesn't solve the problem. Right? And then there's the fairness of I volunteered my body, but you get paid. What's up with that? How fair is that? Right? Then there's the possibility of it backfiring. If you know that at some point there's going to be some incentivization scheme, why wouldn't you wait until that scheme is there? It might slow down uptake, frankly. And there are those who argue that the reward should be an open society. If that's not good enough for you, then there's something wrong with you. So it's a complicated thing, but we're going to have to deal with hesitancy at some point. And I don't think incentivization is the right way to go. I think a science literacy way is the best way. I mean, you hear these anecdotal stories of people talking to the doctor saying, I don't want to take this vaccine because this, and this. Then 20 minutes later, after the doctor explains exactly what's going on, the person says, when can I book my vaccine? You know? So
Hmm.
a little bit of patience goes a long way. Unfortunately, it does require some one-on-one very often. But I do want to
Hmm.
distinguish between those who are vaccine hesitant and those who are anti-vaxxers. Anti-vaxxers
Right.
are a kind of religion, and you don't combat religion with reason. Um, you don't, fight a belief system with evidence. But those who are hesitant just want some assurances or to be spoken to like adults. We can definitely do that.
Hmm. My next question was going to be about incentives and whether you think that they work. So I think you've kind of answered that.
Well, I think they do work. They do work. But what are you trying to achieve here? Are you trying to get shots, this kind of shot into these people? Um,
Hmm.
but they may cause more problems down the line. Like I said, you bought their body for a day, but not their hearts and minds. And if there's an adverse reaction, guess what? You've lost their body forever. Uh, and
Right.
this is not a one-time thing. We're going to need people to accept boosters. We're going to need people to comply with public health for years, if not decades from now. So we don't want to do damage here by reducing this to strictly a commercial exchange. It is not a commercial exchange. It's a biological
Hmm.
medical conversation about personal risk and reward.
Right. All right. I think that's all the questions that I had, unless there's anything else you wanted to touch on.
No, I think I've lectured you enough for today.
All right. Well, thank you so much for calling. Have a good day.
Bye bye.